Good morning, everyone. My name is Murli Raj. Today, I'm going to talk about Snoslin room and sensory integration. So, what is a Snoslin multisensory room? Snoslin or controlled multisensory environment is a therapy for people with autism and other developmental disabilities, dementia, or brain injury. Consists of placing the person in a soothing and stimulating environment. These rooms are specially designed to deliver stimuli to various senses using lighting effects, color, sounds, music, scents, etc. The combination of different materials on a wall may be explored using tactile sensors, and the flow may be adjusted to stimulate the sense of balance. This was developed in Netherlands in 1970. So basically, the snozzle word comes from Dutch words, which means to explore, seek out, and to relax. Snozzle room provides relaxation. The environment can be used to soothe and reduce agitation through the use of gentle lights, soothing sounds, relaxing scents and textures. It provides development. The environment can be used as a learning and developmental tool and can be used to understand cause and effect and to develop thematic learning environment. It provides stimulation through visual stimuli, music, sounds, relaxing scents and textures which are explored. Snozzle multisensory environment helps to create a safe place to facilitate, establish good therapeutic alliance between the client and the therapist. So the indications, basically the age group, any age group can be provided therapy in the Snozzle. So let's talk about Snow syndrome for early age. During development, we learn how to respond to different sensory stimuli. The more we are exposed to stimuli, more our neural pathways in the brain are established and our responses become more efficient. Encourages the development of sensory processing, helps improve fine and gross motor skills, eye-hand coordination, color recognition, and communication. So Snozzle room can be used as an incentive to learn. It provides a space where a variety of interventions can be performed to meet needs easily, quickly, whether for therapeutic, educational needs, or needs focused on using sensory devices to calm, comfort, or stimulate the child. For mental health, it can be used experiencing people with serious illness, sudden prolonged trauma, loss of loved ones, or unemployment, or different states of altered emotions. So multisensory environments can be personalized to create a safe place for the clients to fully relax and to be more receptive for therapeutic interventions. In case of brain injuries, the room can be used to provide support on the way to physical and cognitive rehabilitation, which includes problem solving, decision making, hand coordination, concentration, memory, attention, object recognition, and word finding. So it generally improves functionality of the individual. For the elderly population, it can be used in the conditions affecting thinking, mood, behavior of the individuals, which reflects in the daily activities. One of the examples is dementia. So sensory activities and auditory stimulation provides sort of stimulation which increases the awareness, attention, cognitive abilities. It improves the mood, provides relaxation due to the simplicity of the task. The equipment is used in Snozzle. This includes fiber optic lights, projectors, bubble tubes, trampolines, balance bars, swings, blankets, stuffed animals, fidget spinners, puzzles, speakers, tunnels, soft floor mats, wallproof. So what are the precautions? The general precautions includes the patients or the kids who have seizures, which is not a controlled, talking about uncontrolled seizures, emotional distress due to overstimulation, Risk of allergic reaction, including skin irritation. What are the conditions of pathology where we can use these rules? One is autism spectrum disorder, then learning disorders and ADHD, OCDs, language disorders, behavioral disorders, anxiety disorders, depression, developmental delay, genetic syndromes, brain injury, learning disorder. So now let's talk about what is sensory integration. The concept of sensory integration was first developed and described by Dr. Jane Ayers in 1970s. The term sensory integration refers to the processing, integration, organization of sensory information from the body and the environment. Sensory integration is important in all things that we need to do on a daily basis, whether dressing, eating, moving around, socializing, learning, working. So it is basically how we experience, interpret, or react to information coming from our senses, how it is integrated. Sensory information is received from our senses, which includes vision, auditory system, tactile system, gustatory system, olfactory system, the proprioception, sense of body awareness and position, vestibular, awareness of movement, balance, coordination, and also interoception from our internal organ system, for example, the hunger, fatigue, emotions, etc. 4 categories of sensory integration difficulties has been identified. So one is sensory modulation problems, which is our brain either over responds or under responds to any sensory information. Like for certain stimuli, it can be over responsive, and to certain stimuli, it can be under responsive. Then general sensor over responsivity is the general sensor under responsivity is the then sensory craving. Next is sensory discrimination perceptual problems. Means understanding accurately what is heard, seen, felt, tasted, or smelled. For example, if somebody sees P as Q or Q as P, if somebody says a cat, somebody might hear a cap, or vice versa. And in the balance, or like in the losing the balance when somebody falls, the awareness of falling sideways or backwards. A person with visual perceptual problems may have difficulties with finding objects in cluttered environments or finding a word on a page. Next, vestibular bilateral functional problems. Problems with us vestibular sense and can result in poor balance and difficulties with coordinating the two sides of the body. Next is praxis problems. It basically refers to the motor planning, especially when we learn a new task, for example, driving or jumping. So how common are sensory integration problems? Sensory integration difficulties can co-occur with a diagnosis as well as with no diagnosis at all. For example, like it can be there with autism, ADHD, OCD, or genetic syndromes, learning disabilities, or it can exist on its own without any other diagnosis. A recent study in Finland in 2020 found the prevalence of sensory abnormalities to be around 8.3% in an epidemiological population of 8-year-old children. 2009 study found that 1 in every 6 children has sensory processing issues that make it hard to learn and function in school. There are other studies which has found that 66% of autism children and 32% of children with special needs showed definite differences in sensory behaviors. So what is sensory integration therapy, or SI? So SI includes structured exposure to sensory input, movement therapy, balance treatments, carefully designed and customized physical activities and accommodations. An SI practitioner may work with a client, with their family, carers, school, other allied health professionals, or employer to create a sensory diet for the specific client. A sensory diet is recommended suite of activities and accommodations to help give the individual sensory input they need. So that's about sensory integration in Snow. Thank you for listening.